How are you? Yes, sir. How you doing? Yes, sir. Good.
Yeah, we're just sliding everyone down one. That's it. Right there. Oh, you got the chair?
How are you, sir?
This is Zimmer's code, but we'll just have to move it.
Where did Mike's,
Mike is sitting right there.
oh, he jumped?
I just slid you down one.
Okay. Whose chair is this? Maybe George.
Make sure this is right.
Everyone's slide over one.
877-820-7831. Participant code 336.
George, I'm sliding you just one over, okay? Take one down, pass it around.
Come on, touch your stuff. Do it.
Yeah, let's hope so. It seems like kind of how the mics seems like they get pretty good.
Greg, that's not yours, that was mine, I think.
Nope, not mine.
Okay, good. I set it down to help you musical chair. Good. I got your voice now. It's working, all right? No, it's good. It's pretty crazy. I appreciate it.
Yeah, but they're extinct. That's it.
Good morning. Who just jumped on the line? Let's see if they can hear. Hello, can you hear me? Yeah, it looks like you're at college.
Yeah, the people.
That looks like the state grade.
Okay, quite close. I'll take it.
I grabbed one of my about this, so.
Well, no, but like, but like, I know that's something I don't do. So I'm pretty sure.
So you don't even want me to the scouts?
Oh, yeah.
So anyways, it's
Your part is
okay, yeah, so just a couple of bullet points.
Yeah, it's, that car isn't made for snow and ice. I had, on the way here, I passed 4 spinouts.
I'm just talking about sampling of it.
Yeah, it's
Alright, so it's on.
So just this, I mean, just some of the things that.
It's season. Okay. It just feels like I got you. Went right from summer to winter. It's fall and
The red light is just muted, right?
Yeah.
Okay. We'll keep that muted.
Actually, let me check with Don to make sure that maybe the opposite.
well, you know, my favorite saying, Mark, is I had a boss 30 years ago that once told me, Rich, you want love, buy a dog.
Hello, this is the conference call. Just double checking. Anybody online?
Mark Edwards. Red button means it.
Okay, thank you.
All right, you're sounding okay, thank you.
Yes. Here, Steve Brandon.
Tell me more.
We'll get a chair next, up at the table for you, up on the table, Steve. Yep, right next to Mark Young.
You're gonna have to eat in front of the camera.
Well, good morning. We're going to get started. As we have traditionally done, we go around the room and introduce ourselves. So we will start on this side of the room in the back row. Go ahead, fire away.
Nick Payne, Governor's Office. Bill Chris, City of Flint, Mayor's Office.
Jared Volohodsky, Michigan Department of Health and Human Services.
Eric Oswald, DEQ drinking water.
Commissioner.
Brian Knoll, the County Commissioner.
Kyle Graham, Michigan Department of Education.
Larry Steckelberg, Michigan Department of Treasury.
Santino Guerra, Flint City Council.
George Christian, Michigan DEQ.
Scott Hippica. I'm now the new Executive Director of the Office of Performance and Transformation for the state of Michigan, formerly out of the Governor's Office.
Congratulations, Scott. Mike Zimmer, Governor's Office, representing the Department of Licensing and Regulatory Affairs, the greatest department in state government.
Deanna Johnston, Michigan State Police.
Emmett McGowan, Emergency Management, Homeland Security Division, MSP.
Harvey Hollins, Governor's Office.
Karen Weaver, Mayor, City of Flint.
Rich Baird, Governor's Office.
Steve Branch, City Administrator, City of Flint. Mark Young, Chairman, Genesee County Board of Commissioners.
Jim Koski, representing Genesee County. Trail Mike McDaniel.
Mona Hanna-Tisha, Michigan State University and Hurley Children's Hospital.
Laura Sullivan, Kettering University.
John Keller, Genesee County.
Jeff Freeman, Genesee County Board of Commissioners.
Well, good morning, everyone. This is our last meeting for this administration, for this commission, and we'll start this meeting off with remarks from the mayor.
Okay, thank you. And I know Steve does have an update. I will let him do the update, but thank you for the remarks. And thank you for the nice breakfast. We could tell it was the last meeting. We appreciate it. At least of this group. But one of the things I do want to say is I just want to thank everybody for the time that they've put in to the FWICC meeting. I think we have been able to move some things forward. We've done a lot of work. It's been a ride. It hasn't always been a smooth ride, but it's been a ride and a journey. And one thing I want everybody to know is that through the smoothness and through the fights, it was always about the people of the city of Flint and making sure we were speaking out and working on behalf of what was best for the residents of the city of Flint. So I just wanted to say that we have made a lot of progress. We have made a lot of progress, and we've made some relationships and put some of our differences behind to get some things done, and I appreciate that from everybody. I really, really do. Rich, I know you and I did that quite a bit. And I thank you for that. But I said we still have work to do, and we're going to continue to work on behalf of the people of the city of Flint until we make sure we are where we need to be. One of the things I've said is I'm really taking my lead from the medical community, the scientific community that's here in the city of Flint. And I appreciate the work that you all have done and are going to continue to do on behalf of the residents. We may continue to meet, we may not. We'll see what the next administration decides as far as this group or if it's some other group. But I just wanted to say thank you for everything we've been able to accomplish and know that we are going to continue on. So at this point, I know Steve wants to give some updates on what we've been doing as far as Fast Start, I believe, Steve. So I will turn it over to you. Thank you.
Well, good morning. Pleasant surprise, the mayor was here this morning. I wasn't aware she would be here. So anyway, I would like to give you an update on where we stand with the Fast Start numbers. In 2018, we've excavated 8,410 homes, and of those, we replaced 1,360 lead or galvanized service pipes. As of today, for the total for the Fast Start program, we've excavated and replaced 17,243 pipes, of which the replacements is 7,588, and that includes work from 2016 through last Thursday of 2018. Any questions on the numbers?
How many do you think are left?
Well, we're estimating there's 28,000 pipes in the city of Flint, and if we think we're hitting about 25 to 27% hit rate, there's a possibility of another, 2,400 more service lines out there that we need to replace. So we're way ahead of our schedule that we had out there for service line replacements. As far as funding on the WIN grant, we're still waiting on our funds to come in. We do have it approved through EPA, and we are starting our engineering for the chemical feed building. We've got that resolution going to council next week to get that approved, so we can get that engineering started for our chemical feed building. That needs to be completed by the end of 2019. Any questions? Thank you.
I'm sorry. I was getting Dr. Reynolds, who was trying to be incognito down there. He has a seat and a name placard right there. So.
May I have your attention, please? Subcommittee will be conducting a test of the building fire alarm system.
Okay.
Please disregard all fire alarm signals until further notice.
Okay.
Subcommittee will be conducting a short test of the building fire alarm system. This is only a test. Please disregard all fire alarm signals until further notice.
That's great timing. Yes. Anyone have any questions for Steve? Dr. Tisha.
Steve, so you said you're ahead of schedule, so when do you think it will be done?
Well, it really depends on the weather. We're continuing to working. It's snowing out there today, and we don't know when it's going to get cold so that the ground would freeze, and we probably won't do any service line replacements, but we start in the spring. And, at the rate we're going, 2 or 3 months next year.
Right, so early 2019?
I would say mid-2019. Yep.
That's great. Any additional questions?
Steve, could I follow up on that? Would that be on the same contract, or will you have to do a new RFP for 2019?
I believe we'll have to issue a new RFP.
All right. We'll just let this play out for a second here. Here we go. Okay, Mark Young from the Genesee County.
Okay, just give you an update on the Healthy Start grant in addressing preventing the lead exposure. Summary update. As of yesterday's meeting, we had all of our contract partners that were designated in the grant had signed on. We are continually looking for the potential of other partners as we go through and formalize and identify other families and other issues that could be beneficial to the program. Required community organizational partners that were named in the HRSA grant were Genesee County Health Department, Greater Flint Health Coalition, MSU Hurley Pediatric Public Health Initiative, Genesee Health System, Genesee Intermediate School District, City of Flint, and Priority Children have been added as approved for the work plan. All of our partners are in the process of hiring staff. They're conducting outreach, case finding, and assess the children's needs. Other community agencies are being identified who could assist in this work. And then our partners continue to meet and work on data sharing processes to minimize duplication in contacting residents. We did have some input from Board of Health, and I'd like to, if you can give me the courtesy, let our Health Director speak here. John McKellar.
John, can you grab one of those mics down? Thanks.
Good. I'll stay standing so that I can be seen. Thank you, and good morning to everybody. Just 3 quick points that I would like to share with you. Would like to remind you that the emergency declaration in the county, as recommended by the Board of Health, remains in effect. We are supportive of the mayor's recommendation, as well as the recommendation of the Genesee County Medical Society, that until the water lines are fully replaced, that residents continue to use filters in their homes, and if they're unable to, that they continue to use bottled water, particularly individuals who are under the age of 6 and whom otherwise might have medical conditions. I would also like to let you know that in early October, the Board of Health passed a resolution in opposition to municipal water system shutoffs. We worked cooperatively with the public health advisor in the city of Flint and other folks in the city to craft the language so that we were all acknowledging the public health impacts of not having running water in a habitated home, but realizing that the city has an obligation to fund their water system infrastructure in a sustainable way, and committing that we all work cooperatively in that direction. But from a pure public health point of view, it is unhealthy not to have running water in a home where folks are living. The third point that I'd like to make is that several agencies in town are working cooperatively to avoid water shutoffs in homes where individuals have been identified as having elevated blood lead levels. We're working with the Michigan Department of Health and Human Services, with the City of Flint, with the Greater Flint Health Coalition to identify those individuals who are on the city's proposed water shutoff list, and we're at the Health Department matching that list with known homes where at-risk individuals live, and sharing that information with the Michigan Department of Health and Human Services, who are sharing it with the city and with the Greater Flint Health Coalition, and actually Cheryl Thompson behind me here representing the Michigan Department of Health and Human Services is assisting with a funding mechanism through the United Way to provide some funding to offset those in arrears water bills for those homes. So more to be said on that as all those details get worked out. But I'm pleased as a member of county government to be a part of this incremental approach to addressing the water shutoff issue. Those are the points I'd like to share, and be happy to answer any questions.
Dr. Sullivan and then Dr. Reynolds.
I'm really happy to hear that we're looking at homes where people have already demonstrated high lead levels. I'm wondering if it were possible to add to the list of homes which we try and delay shutoffs, any home of a child under the age of 6, and any home where there's someone who might be at risk of some of the diseases that are spreading, like hepatitis A. I'm concerned about the health impacts on those populations as well. Thank you.
Thank you.
I haven't heard. Is the hepatitis A outbreak over? Because it was regional, then multi-state. Can anybody answer that? Is there someone from the health department? Well, you know, we said there was no hepatitis A outbreak when we did the water shutoffs in Detroit. What was it, 44,000 homes had their water shut off, and then a year later there was a hepatitis A outbreak. Now, folks will say those things are unrelated. However, it's like having a house on fire and you tell people they can't use a water hose to put the fire out. And what we have been saying additionally, if I can use another fire metaphor, is I'm pumping gas while I smoke a cigarette, and there's been no explosion to date, so everything must be fine. That's unacceptable from a health aspect. And if the state is going to declare an emergency, and they did activate their emergency centers both in the state police as well as in the health department, why then are they not assuring that no one's water will be cut off during this outbreak? There seems to be a disconnect that I can't fathom, and I was hoping there'd be someone here from the state health department who can answer that.
I think Cheryl's the only one here, but I'm not sure she's in a position to answer that question, Dr. Reynolds. And she's shaking her head no. Dr. Sullivan.
I guess I'd just like to add that this isn't the first time that Dr. Reynolds has asked that question at this meeting. I think it might be the second meeting where he's answered, and could be the third meeting where he's asked that question and it's gone unanswered.
It's actually 3 meetings, so you're correct. It was brought up first early summer, I believe, that you first raised the issue. So this will be the 3rd time. Any additional questions for either Chairman Young or John? Okay, seeing none. Amir.
I just wanted to add something. I just wanted to make a comment because I did hear General McDaniel asking if we were putting things out to bid. And if we have to, we'll do that. But I do want to say, we're trying to get as many pipes taken out as possible, as quickly as possible. And so I think it's in the city's best interest to continue and not stop the contractors, because anytime you have to put something out to bid, you lose time. And people are ready, the people that haven't had their pipes changed are ready, at least to have them, if not changed, checked. But if we do have to stop and put it out for bid, we will do that.
Okay. Moving on the agenda, we have Dr. Edwards who's on the phone. Dr. Edwards, I think, is the mic on for him? Yes. Are you still there?
I'm here. Can you hear me?
Barely.
Okay, go ahead. Sir, you're just going to have to tell me when to flip the presentation slide.
Yeah, so go ahead and put them up.
They're on.
Okay. Well, what we're doing is reporting the results of citizen science monitoring of chlorine levels around the city that complements data that's collected by the city of Flint. And as you know, one of the key parameters that we have to meet is to try to maintain good chlorine residuals throughout the system. And so this report's results from June 2018 through September 2018, and this was done by Kaylee Mosteller, Carrie Weber, Victoria Weber, and Leanne Walters. And Leanne would have presented this, but she has an emergency, she has a medical procedure she has to do today. Next slide. So our method is basically the same as the city. We went to designated sites throughout the city. We tried to go to the city sites, but some of the places the city samples will not let us sample. So in those cases, we tried to find sites that are close by to get as close a data as possible. We'll point out here the city of Flint uses a standard protocol where they flush the water until cold, and that means anywhere from 10 to 30 minutes of flushing before they collect the free chlorine test. Whereas in our approach, we used a fixed 5-minute flushing protocol to determine the chlorine level. Next slide. So these illustrate the geographical distribution of the city of Flint official sites in the blue. And we sampled 8 of those sites who would give us access, and we also came up with 14 of our own sites to try to complement those from the city. And this was a pretty extensive effort. It was over 250 samples over 19 weeks. Next slide. And so I'm reporting the results of the City of Flint data because it's helpful to show just how far we've come. When we went in August of 2015, for example, at the City of Flint sites we monitored, several of those had no detectable chlorine. Many others were below 0.2 milligrams per liter, and these results from summer of 2018 indicate very consistent, very satisfactory chlorine residuals throughout the city. So kudos for everyone for doing the corrosion control and the dosing of chlorine and whatever flushing was going on, because these would be considered very good results for just about any city in the country for free chlorine. Next slide. Our data with the 5-minute protocol showed a different trend slightly than that of the city. Specifically, it showed an effect that in the warmer months with less flushing, the chlorine levels were dropping. And so in general, in the cooler months, such as June, when we took samples, we got virtually identical results to the city with our shorter term protocol. But you can see as the water temperature warmed up, a 5-minute flush wasn't adequate to get clean water to the taps of our monitoring site. So next slide. And this graph shows the difference between the city's results and our results, and we feel that this is due to the difference in flush time. And what it shows is kind of the influence of the service line and the premise plumbing on the chlorine residual. And you can see that as the temperature rises along the x-axis, the chlorine level is dropping more. And so what this implies is that in the warmer months in Flint and in other cities around the country, if a consumer wants to get rid of the effects of the building plumbing or the service line, they might have to do fairly extensive flushing, more than the 5-minute time to get rid of taste and odor problems, to get a good chlorine residual to the tap. So the next slide is just our conclusion. Based on the results that the citizens collected this summer, and I wish they were here to present that. But there are very good levels of chlorine residuals throughout the system, both based on the citizen data and the City of Flint data. With adequate flushing, we're getting really good chlorine residuals throughout the city. That's what the City of Flint data shows. But even 5 minutes flushing in the summer in Flint and in other cities, it's not adequate to clean the pipes out completely. And so we also called Susan down at Genesee County Health Department and just checked during those warmer months of this year whether the Legionella caseload was in the normal range, normal meaning before the Flint water crisis, and the results, even with the enhanced monitoring, better detection, are still in the normal range for 2018. And so our key takeaway here is that in Flint and in other cities, I think we want to start considering whether longer flushing times or recommendations might be given to consumers to clean out the pipes if they want to get water that is aesthetically pleasing, that doesn't have taste and odor problems, for example, and has a good chlorine residual. More than 5 minutes flushing might be desirable every now and then. And this harkens back to what we've been struggling with in Flint and in other cities as water use goes down. The plumbing systems were really designed for a higher level of flow, and that's certainly the case in Flint. And so just keeping water moving through the system and flushing by consumers is just going to be something we have to recommend and emphasize for the foreseeable future. So with that, that's our data, and if there's any questions, I'd be happy to answer them.
Okay, before we continue with questions, I think you wanted to add something, George, to Mark's presentation.
Yeah, so I did have the pleasure of speaking with Leanne just yesterday regarding the citizen science study. And so first I want to make sure that we acknowledge the value and the efforts that these folks have put forward, because they've done a tremendous amount of work, and the data that they've derived is extremely helpful. There are two things that I want to just reiterate because they bear repeating, and it's something that we've been talking about for a pretty significant amount of time now. With the two different flushing times that were utilized, one is pretty much a standard protocol that the city utilized, because what you're trying to do is determine if those chlorine residuals are carrying out into the outer reaches of the infrastructure, and it appears as they are. But as Mark had pointed out, the infrastructures within the buildings, the premise plumbing, those types of situations, it kind of underscores what we've been saying before, the importance of water usage and the challenges with oversized infrastructures in cities. So while this certainly applies here in Flint, it definitely applies to a number of cities that have experienced declining populations. So this is tremendously helpful data.
Any questions for Dr. Sullivan?
If it takes 30 minutes of flushing before I have a sufficient chlorine residual, and that, as I can say that for myself, my 5-minute flushing in my own home wasn't sufficient, and I was told to just try a 30-minute flush. If it takes 30 minutes before I have water coming into my home that has sufficient chlorine, then we're talking about more than just the water that's between the main and my house that I'm flushing. We're talking that I'm having to pull water from a greater distance, right?
So as I indicated, we are having issues with the fact that the infrastructure in the city of Flint is significantly oversized.
Right. So could I add that there might be one other reason, in addition to the fact that the infrastructure is oversized. In neighborhoods where we don't have blight, where all the houses are occupied and water is being used in all the homes, couldn't we agree that one reason that the residual chlorine levels are low, in addition to the potential of the infrastructure being oversized, is that the chlorine is being taken up by other mechanisms than maybe existed before the pipes were corroded?
We would have to look into that. So that's certainly worth discussing.
And then I have one other question that was passed along to me from a resident, and that is, how can, residents have been asking to be able to monitor their own chlorine levels. I brought up at a FWICC meeting at least a year ago a request to have a method for residents of Flint to be able to monitor their chlorine levels just to help to assess their risk, in addition to perhaps flushing. Is there any mechanism for us providing residents in Flint who want to be able to monitor their chlorine and to participate in a citizen science exercise like this? How can we
provide? The answer is yes. So after, as part of we hope to do that next summer. This summer, what we did is we compared the color wheel to the digital approach, and it did so very favorably. And so Leanne is going to be coordinating that, and I think we're going to be able to make up to 20 to 30 of these color wheels available and instruct consumers on how to use them to measure the chlorine in their own home.
Mark, this is Mona. Is chlorine, if you test the chlorine in your house one time, is it variable? Like the next day, that evening, will it be different? So, I mean, I assume it's different on time of day and season of the year. Is a one-time test reliable?
Right. A one-time test would be reliable, especially in the summer months, and it's kind of like lead, wherein you'd always want to test the worst case. So if folks were testing in, say, July or August, and they tested to see how long they have to flush at their house to get a good residual, by doing that under the worst case scenario, they get an idea of how long they'd have to flush in that scenario. We also hope to come up with an equation next year that would tell people how to adjust the flush time as a function of the season. So in the winter months, for example, it's quite likely that maybe a 1 or 2 minute flush would be more than adequate in most homes. And so the idea is if you calculated the flush time you need at your house during the worst month, we'll have an equation that allow you to adjust that for the season.
Dr. Reynolds.
I live in Flint, so I use a filter every day, and I imagine there are several residents who are doing the same thing. This information may be fine for a system where we're not using filters on a large scale, but does it address the removal of chlorine by the filter and the bacterial community that is between the end of the carbon cartridge and the outflow? If I recall correctly, Homeland Security was requesting studies for long-term use of point-of-use filters in emergencies. So I'm wondering if there's sufficient information for us to say we've answered the whole problem for varying chlorine levels and point-of-use filters that remove chlorine for a population.
So the answer to that question is that these filters are in widespread use in systems with chlorine all around the country. It's estimated on average probably 20-25% of homes have one of these filters that remove chlorine in them. The present state of the scientific knowledge is that the bacteria that grow on those filters do not pose a significant human health risk. Of course, we're always being vigilant, and if new information is developed that says something to the contrary, that would be considered. But that's the present state of knowledge, and these filters are in widespread use already.
My question is, what constitutes adequate vigilance? I mean, if you recall, we were told the same thing about lead levels and chlorine levels in the past. So what would constitute appropriate monitoring, and have we answered that question yet?
Well, the filters are in use in many homes that do not have any chlorine at all. Not only because of where they're located, but there's many systems in the country that are not chlorinated. And the health studies that have been done to date, and there's been some epidemiological work, there's been a World Health Organization study of these filters, and the consensus presently is that the bacteria that grow on these filters, and we've known about bacteria growing on these filters for 30, 40 years now, they do not pose a significant human health risk in Flint, or in groundwater systems that have no chlorine, or in other systems around the country that have chloramine or chlorine. So people are studying this all the time. They've been studying it consistently for 40 years. The vigilance is that someone might eventually do a study that does show there's a health risk, but the studies to date have come up short of finding anything, and the benefits of these filters are real in terms of improving the aesthetic quality of the water and providing very good protection against lead. And so ultimately each consumer out there has to make a decision about whether the benefits, which are real and proven, outweigh the risks, which people are still looking for, if they exist.
Mayor Weaver.
I have a couple of questions, and one is around the flushing. So when I get up in the morning and I do the flush, then I go to work. Do I have to flush again when I come home that evening?
Well, you don't have to do anything. So, consumers all around the country, many of them decide not to flush their water. And as a result, you're getting water that's not quite as good a quality. It's either not as cold, or it has potentially more bacteria, or it's got more discoloration in it.
I understand that, but you just talked about a flushing protocol. So I'm asking if I want the clear water without the color, without the odor or the taste, and I have flushed that morning, would I need to do it a second time when I get home that evening if I want the same water?
And the answer is yeah. If you wanted to have the confidence that you're getting the highest quality water possible, you would always do the flushing before you collected water for cooking or drinking.
Okay.
And obviously most consumers around the country don't do that because they don't have time. But your individual experience is very important here. If you feel the water is distasteful, or it's not cold enough, or it's discolored, your individual experience is that you should flush longer. And so we hope to supplement that individual experience with the chlorine test kit distribution next summer for those who are interested in seeing how long they need to flush to get good chlorine residuals.
Okay, and then my second question is, once we get to the point where we are declaring the water safe, is that something that will still stay in place?
Well, I can't speak for Flint-specific advice, it's kind of official, but this kind of advice is what's out there for consumers all around the country in terms of trying to improve the aesthetic quality of their water and the implied safety of the water, both in relation to lead and bacteria.
Okay. Thank you.
Rich?
Dr. Edwards, Rich Baird here. So my question is, if Flint were able, over a period of time, to right-size their water delivery system consistent with the population and density that they have, would you expect the flushing requirements to change? And I guess the corollary to that question gets back to what Dr. Sullivan asked, is that the research that you did you find a correlation between high-density residential neighborhoods and the chlorination from not having to flush because water was flowing on a regular basis routinely through those faucets?
So the answer is no, we did not do that correlation, although I have little doubt that one would exist based on past studies in Flint and elsewhere, and that yes, indeed, if we could resize the water mains, that might reduce the flushing that's required to get a good chlorine residual. However, I will point out that the City of Flint monitoring data is showing that with adequate flushing, until the water runs cold, in some cases that is taking 10 to 30 minutes, that the water in the mains is very consistent, and even in the summer months had very good chlorine residuals. So right-sizing the system would improve that, but the results that the City of Flint is getting now are considered very, very good by almost any standard, and I think that reflects the very good corrosion control that's been in place now for several years. In changing the water mains is not going to overcome the problems that you get from your service line or your in-home plumbing. And so while it's going to help some, unless like the service lines are upgraded from galvanized iron in particular and the home plumbing is upgraded, flushing is going to be required as long as those antiquated materials are used for service line or in the home plumbing.
Dr. Sullivan?
I just want to make sure that I heard you correctly, Mark. Did you say that you haven't yet been able to establish a correlation between the density of a community, of a residential neighborhood, how many homes are occupied, and the chlorine levels at the homes?
That was not the intent of the study.
Sure.
So we have not attempted to do that.
Okay.
And we don't have the data to do that. Anyone who wants to use our data to try to do that, we'd be happy to let them do that. It's just not a goal of our study, but it would be logical, and past studies have shown that over and over and over again.
Sure. So if you have a community, if you have a neighborhood that is densely populated and there are consistently low chlorine levels, then that would not follow the logic, right?
Well, it depends on, it's not just the population, it's how the water is routed through the mains. And the water use in that area. So, there's a lot of variables. It's just not density. It's like sometimes a valve is closed and the water takes a very circuitous path, and, and what is the main material? There's a lot of factors that go into it. So that's a super important study. Those types of studies have been done, but that was not the intent of our work.
Thank you.
Any other questions for Mark? Dr. Edwards. Dr. Pugh.
Dr. Edwards, and I know that Don McKellar is here. I do believe, you mentioned that the Legionnaires' cases were down. Did I hear you say that towards the end of your...
Normal.
Or normal, and we have seen increased numbers. I don't have them, they're in the 20 range. I think around 8 of those are residents in the city. Is that right, John?
I have exact numbers. It would be the desire of the committee that I share those.
Yes, I think just because we want to make sure I want to make sure our communication is clear, because we've recently put out a media release that said that we've had increased numbers.
Sure, John, can you grab the
Right,
mic?
what I was speaking specifically about were cases that might somehow be related to the water system, as we believe was the case during the height of the Flint water crisis. So obviously there's many sources of Legionnaire's disease, and for each case we don't always determine the source. And what we've indicated here is that, as was the case during the crisis, the water related Legionnaire's disease is going to be highest in the summer, as it is from almost every other source. And so when I talked to Suzanne at Genesee County Health Department, we were looking specifically at those warmer months where there were 4 and 5 cases this year, I think July and August. And was that abnormal compared to years prior to the crisis in terms of number of Flint residents, et cetera? And it's still in the normal range for those 2 warmer months, specifically when we think the risk from Legionella and water is highest, not only in Flint but elsewhere.
Dr. Edwards, this is John McKellar. I'm the director of the Genesee County Health Department. And what Suzanne shared is relatively correct. And I do have some exact numbers that I did bring this morning that I can share with the committee. In terms of overall Legionnaire's disease cases in the county, during the height of the crisis in 2014, there were 40 cases. In 2015, there were 46 cases. In 2016, it dropped to 17 cases. In 2017, 13 cases. And in 2018, through early November, there have been 24 cases. So it is still half of the reported cases during the height of the crisis, but definitely higher than the last 2 years. However, as you pointed out, those cases are well dispersed throughout the county. Also dispersed, as they have been historically, with higher cases in the summer, the warm summer months. The Genesee County Health Department investigates each of these cases thoroughly and has not determined any particular pattern that we would be alarmed about or want to report to the community.
Excellent. Yeah, I agree with that. And let me just reiterate, like Legionella comes from many different sources. Water is one source, and that's the one we're trying to be most vigilant about here. The other thing to note is in the last few years all around the country, Legionella cases have been going up due to better monitoring, better detection, and I'm sure that's the case in Flint as well. So all of those things have to be factored into the equation, and you're doing that. So.
Okay, any other questions for Dr. Edwards? Okay, seeing none, George and Scott. Go first.
Good morning. From the Flint Water Advisory Task Force report, one of the recommendations was that we institute a school drinking water quality program. And so in response to that recommendation, and I'm sorry, I know, by the way, that could serve as a nationwide model. In response to that recommendation, there were funds that the state was able to capture through House Bill 4320, which I've talked about this in the past. It was that was signed in December 20th of 17, and it's a $1 million program. The funds for that program were set aside to include a number of different, statewide initiatives, if you will. So within that, it included instruction and training on water testing, instruction and training on the development of a school-wide flushing program within each facility, and that would essentially teach the schools how to prevent the stagnation of the water after extended periods of non-use. And then another element would be from essentially a door-to-door as well as an online training module, series of training modules to essentially deliver the training throughout the school. So it's a online suite of training as well as a door-to-door with a consultant to actually provide that training across the state. And so that program is now in full earnest. We conducted a series of online webinars where we rolled it out throughout the summer. George will speak to some of the specifics associated with some of the outcomes and some of the best practices that we've started to see now as schools have adopted this across the state of Michigan.
Thank you, Scott. So, as Scott indicated, we have rolled out the program and we have conducted a series of webinars. And so we continue to work with the Department of Education to try and make sure that schools are aware across the state of the resources that are available with respect to this program. There has been some funding made available so that schools can conduct plumbing evaluations of their facilities so that they can have a more educated process towards whatever sampling they may put in place. And we've also worked with schools to talk about the importance of water use and flushing and that sort of thing. There's been a number of schools that have been implementing some of these protocols, and we're looking to hopefully next year do a little bit of work in terms of looking at the effects that flushing has within schools and the positive impact that the water flow has. We've had data from, for example, Freeman Elementary that shows the positive effects of that, and so we're looking to have additional schools participate in these types of processes so that we can just show that this was not something that occurred in one facility, but this is a process that can be utilized throughout schools, not only in the state but across the nation. So as a segue to that, given that this is the last meeting under the current administration, I did want to share with everyone kind of a synopsis of some of the efforts that we've been doing citywide, just all of the different efforts that we've been doing. So with respect to CORE, we've had over 510,000 visits that have been conducted since the program was instituted. And of those, approximately 158,000 of those resulted in conversations with residents. So clearly, there's approximately 28,000 residences here in the city. So we've been able to reach out to folks on multiple occasions. Just through the CORE program, we've been able to deliver over 23,000 filters to folks, and we've delivered over 150 162,000 cartridges to residents. So, you know, we've worked hard on trying to make sure that we speak to everyone that we possibly can. With respect to some of our sampling efforts, with the schools, we've taken over 10,000 samples in the schools since October of 2015. The residential program, with respect to 1 liter bottles, because that's where we started initially, and this does not include clear, sentinel, or LCR testing. There have been over 23,000 samples that residents have submitted. When we switched over to the 2-bottle kit about a year and a half ago, or whatever that date was, I can't remember precisely when that was, there's been additional 4,400 2-bottle kits that residents have submitted. Another program that was implemented was the food establishment testing that was conducted through MDART. And through that program, where they worked with restaurants and facilities that had water for, such as gas stations that had drinking fountain or pop fountains, that kind of thing. MDARD had 679 samples through that effort. In working with HHS, they incorporated water testing into the elevated blood lead level investigations that were being conducted in the homes. And through those efforts, there were over 7,700 samples taken through those particular efforts. Our friends at LARA, which is the best department in the state, by the way, with respect...
Excuse me, but I'll tell the Director of the Department of Environmental Quality you just said that.
So at any rate, with respect to daycare, foster care, health and wellness facilities, through LARA, we've done an additional over 2,300 samples at those facilities. When we did the Sentinel and the Extended Sentinel program and the LCR program, there were over 5,000 additional samples taken there. When we did the Clear program, there were 1,250 samples that were taken through the Clear program. When we instituted the fixture replacement program, we had over 3,300 homes that we were able to replace at least one fixture at. So this is just kind of a brief synopsis of some of the activities that we've done, but as you can see, we have done a tremendous amount of testing, a tremendous amount of outreach, and we've been able to, do our very best to bring about a positive change for the residents.
Any questions for George or Scott? Dr. Sullivan?
You mentioned the testing at the schools. I know that sometime in the last 6 or 12 months, there was a change in protocol for how you tested at the schools. How many of those 15,000 tests were conducted after that change in protocol?
I don't have that breakdown. So, Laura, the way we did it was always intended that when we did the testing, it evolved over time. So there were actually probably 3 or 4 different processes as we moved forward. So at the very beginning of the testing, we had utilized 4 125 milliliter bottles, and then we did sequential testing at the end. That eventually progressed to 250 ml bottles, and then we started doing focuses on different things because we wanted to drill down deeper into what was happening and basically say, okay, if we test this way, what is the outcome? Sometimes we tested the filters because we wanted to make sure that the filters were effective. So there was a whole variety of different samplings that we did, and I don't have a breakdown of how each one of those protocols, bore out.
So So my point then is that when you talk about a number of tests conducted, and there are many different protocols or methods used, scientifically, you can't say that my data or my assumptions are based on 15,000 tests if there were 5 or 6 different protocols used. You can only make statements based on the number of tests that were conducted with one protocol, with the same protocol. And so my point is that many of us here in Flint are weary of hearing about the number of tests conducted and the fact that the city of Flint is one of the most tested in the country. When we know that to prove a thing, to identify a problem, it doesn't take 15,000 tests. It takes 15,000 tests to try and mask a problem. And so my concern is that when you change protocol, that the appearance to the residents of Flint is that you're changing protocol so that you don't find something.
So to address that, each protocol was a piece of the puzzle. Each protocol told us something, and that led us to look at something else. We were asked very specifically to test filtered water so that we could defend the fact that the filters are effective, and we did that. And we were then we went back to unfiltered testing, and then we were asked again, okay, it's been a while since the filters have been tested, so we were asked very specifically to go back to that. So each protocol was a piece of the puzzle. Each protocol gave us a piece of that puzzle and helped educate the next step that we were taking. So we did a number of different steps, and each phase that we did individually had a very significant number of samples associated with it. So you have to take a look at the aggregate to help you draw some conclusions.
Dr. Atisha Monahan. Atisha.
So, as we now know and recognize, lead in schools and childcare facilities is a national issue and obviously a statewide issue. And the EPA released dollars as part of the WIN Act, which passed, where the Flint bill was included in December 2016, for all states to apply for more dollars for childcare testing and school-based testing of lead and water and remediation. So the Michigan Childhood Lead Elimination Commission was really supportive of the state's application for these dollars. The state has to apply, and my understanding is that DEQ is the lead agency that is going to apply for this. So that's great news. That would bring in additional dollars to the state so that schools and childcare facilities increasingly will test appropriately and put in remediation for our schools. So that's great news, and hopefully we can leverage these dollars, which are still not enough to fix the problems just in our state.
Dr. Pugh.
And as we talk, the previous conversation as well as this conversation, we know that right-sizing our system is one way that we will get our water moving the right way, but we also know that we have to build trust in our water system because of what the city of Flint has gone through. And so whether it's, some of the things that we're doing in the schools above and beyond what the state is doing and was proposing, or whether it's, how we decide how we think is best and we know is best for excavation to replace our, to determine the composition of our pipes. We here in the city of Flint are really concerned about our residents' health and well-being, and that includes making sure that we build confidence in the water system, which is different. I mean, we're talking about Flint and the rest of the world, but here in Flint where we are, we know we have to continue to go above and beyond to build trust and confidence in our water system. So some of the things that we're doing in Flint, in addition to, looking at how do we right size subsidize, looking at making the water more affordable, but just making sure that residents, students, and parents trust their water system. And so with the proposals that the Technical Advisory Council, Dr. Sullivan, Dr. Reynolds, and others have really worked hard. Dr. Nancy Love and Sean McElmurray have worked really hard to help us put together a plan. We didn't know how that funding was going to come about. We didn't know if the plan would ever go through, but we put something down that we knew was going to be best for parents, for knowing that their children were going to be able to best monitor and treat their water. So in Flint Community Schools, they will have UF, they will have charcoal filters, so ultrafiltration, charcoal filtration, and and UV, as well as have bottled water into the end of June. So that is what we're doing. We didn't want to do the flush and monitoring. We wanted to make sure that we had a system that was going to be in place from here until the end of time. And so we know that we have to address the concerns of the residents in that way. So I just wanted to mention that.
And thank you for that. Dr. Reynolds?
As a pediatrician and my colleagues started some of those concerns, our concern is for all school children and that Flint would be the model. Now, please recall 2 out of 3 of our school-age children go to school, non-Flint schools. They're either in charters or schools of choice. So the question remains after 3 years of FWICC, have we in the state achieved the commitment to assure that school water quality is safe? And how many districts have you had to tell you get lost? We don't have the money for it. We're not going to do it. How do you harmonize the need to protect children's health with the state home rule policy?
Well, let's start with your first part of the question. And so when DEQ tests or involves themselves in testing schools, is that just public schools or charter schools or what? I mean, is it all schools in Flint?
Yeah, we did the Flint Community Schools, we did the charters, the parochials, the daycare centers, the elder care facilities. So we tried to identify as many population at risk areas that we could. So when we talk about schools, it's actually a very wide lens that we have.
So it's all schools. That's.
But I'm talking about schools that are outside of the city of Flint that still have the same issues. And my question still is there a new commitment on the part of the state, Health and Human Services, the Michigan Department of Education, DEQ, LARA, to assure that children in the state of Michigan are getting safe water and it's adequately monitored, and that there will be measures taken to prevent exposure to lead? And for 3 years, I have not received an answer to this question.
So, Dr. Reynolds, I don't know if this is quite the answer you're looking for, but the statewide program that Scott and I were just discussing is the first step in that direction. We are trying to communicate with all schools to try and make sure that best practices are provided in the schools, that they do their plumbing assessments so that they understand how the plumbing is routed, so that they understand the proper sampling techniques so that they can get the best quality data that they can. So we have gone down that road now.
So what I hear you saying is participation is voluntary or mandatory? This is the essence of my question.
This is a legal answer to your question, not probably where you're going. Participation is mandatory. The funding is an inducement. The only way you can make it required is a statutory amendment, which, as I think you know, this group has recommended, the governor has supported, but has not gotten traction.
Okay, and that will require legislation
to require testing.
Yes.
Not, you can provide funding, you can provide inducement. but to require testing as a condition of, for example, licensing a daycare facility, or to deem that you have met construction standards in a school, requires legislation.
So we have made the initial steps, we have provided incentives, but we really have not closed the loop to the degree that we need to assure that school water quality is safe, monitored, and the fixtures are also appropriate.
Correct.
Okay.
To require it.
Yes.
Dr. Tisha, looked like you wanted to say something.
I'm just saying, I mean, the dollars that were allocated for testing weren't even that much to do the adequate testing, and that doesn't even include the dollars that are needed for the remediation, which is the biggest expense to install a lot of these filtration hydration stations to do the ongoing monitoring. So there's a lot of additional resources that are needed at the state level to guarantee safe drinking water, and in my opinion, we're not there yet. And these are great steps, but we have a long way to go at a state level, and Flint is absolutely leading the way.
Kyle, do you have any comments regarding what the Department of Education and how they're participating in this?
I think George and Mike covered it. I mean, from our perspective, we are trying to do as much as we can to incentivize schools in doing it. There are resources that were provided to schools to test in consecutive years, and we had very slow uptake on schools that actually took advantage of that. So as part of the water quality program that we're working on with DEQ is trying to go door to door and using the resources we do have to force schools to have some of these conversations. And to be frank, we've had a couple of schools that have in our state that have turned us down when we've done that at this point. So we're doing our best absent of legislation that requires the work that Dr. Reynolds and others are asking about. We're doing our best to incentivize people to participate, but our resources and our authority only go so far at this point.
If I might want to add something to that, so when this crisis occurred here, we went to several urban communities and their school systems and asked for them to really consider testing, and the response was almost as what you don't know won't hurt you kind of response, and so to Mike and George's comments, it has to be required. It has to be required because I think some communities are maybe afraid of what they might find. And so that, I just wanted to underscore that, Dr.
Yeah, I would just reiterate that. The Government Accountability Office at the national level recently released a report about school lead testing nationally, which really, the bottom line is there are no regulations. So schools nationally are not mandated, or childcare facilities, to test for lead in water. There are many who are doing it and many who are obviously finding lead in water. Many don't want to look because there are not the resources nor the guidance to move forward. So we can't have this be an unfunded mandate. We need really clear direction on what schools need to be doing.
Pew.
And just to add to what Dr. Mona just mentioned, we were given, the funding that was given to the schools, and Kyle, you helped us to realize this, it was only like $900 per school. It was being stated as if the schools weren't using the funding, but you made that very clear to us that it was not adequate, and you were hearing that from the field for them to be able to address the concerns that they had in their schools.
Depending on the size of the school building, yes. Those that had larger buildings and more faucets, more things to test, the money was not enough.
And then again, as Mona mentioned, the funding that's coming from the Environmental Protection Agency, and I know Mayor Weaver has educated and talked to the EPA about this and the concerns that we have. And so I think it was $20 million that nationally. And so we had Claire Barnett, who has been at the forefront of these issues here for Children's Environmental Health Day, and she talked about in New York they couldn't spread $20 million around that state. So again, I just want to put some dollars and figures, as well as making sure we're putting before you what the issues are for these schools who do want to make sure that their schools, that their children are getting quality, safe water. And we do hear from our child cares, we do hear from our charter schools, and they are hoping that the city of Flint, the Flint Community Schools, can be a model. And all I ask for the state is to listen to us. We don't want you telling telling us what needs to be done. I just want to reiterate that we're hearing and we're here with these communities, so we know what it is that they want. And if you could just help us to figure out ways to make these things happen. And I know that's, I've said a lot in that, but sometimes it feels that you're telling us how things should happen based on how things have always happened. I know we have limited laws and regulations that drive this, but some of the research that we've now done here in Flint can help not only Flint, but the state and across the nation. So I just wanted to reiterate that.
Thank you. Any other questions? Dr. Reynolds.
Just a statement for those of us who will be around the table and in agencies after January, and I thank those of you who are sticking around and continue to work. The question will be, how high will the state of Michigan aim, or how low will we aim to protect the health of children? And as a pediatrician, as a parent, as a grandparent, that's not a question I can let slide. My daughter attended Freeman School. It was a long time ago nonetheless, but how long are we going to aim as low as we can? And it may be beyond the scope of the people around this room, around this table, but that is something that we are going to have to address as far as school water quality and safety.
Okay. We're going to move the agenda to the KWR project update. Mr. Chlorine. Oh, he's on the phone? Oh, I'm sorry. Can you hear us? Oh, okay, hold on. We're going to turn your mic on in a second here. Okay, go for it.
Yep, all right. Good morning, everybody. So I'm going to give an update on the activities that KWR has been working on. Our activities have focused on data evaluation and epidemiological research in relation to the Legionnaires' disease outbreaks. And in conjunction with that, we also have been working on a healthcare outreach program with the purpose to prepare an outreach program for the health sector, focusing on water management and Legionnaires' disease prevention. And the following is an update on these activities. So KWR, at the request of the state of Michigan, is currently in the process of carrying out a scientific and independent retrospective outbreak analysis, of which a couple of months ago I gave an update as well. This outbreak analysis means that we are looking back at the outbreak situation using existing data. And the objective of this study is to investigate Legionnaires' disease cases in Genesee County in 2014 and 15, and to determine the strength of association with possible Legionella sources. The strength of association comes from the number of cases that share a particular exposure, and that then can point to a possible source of exposure. So we're really trying to establish the source of exposure here. In our investigation, KWR is following the Center for Disease Control recommendations for steps of an outbreak investigation. And KWR, to this effect, has mobilized an outbreak investigation team of epidemiology and outbreak investigation experts. This team has developed the investigation from the ground up, and an independent scientific review panel of internationally recognized Legionella experts has been put in place to provide independent oversight of the scientific quality of this retrospective outbreak investigation. The KWR team has developed this investigation from the ground up. So the Legionella outbreak investigation is conducted, as I mentioned, as a retrospective investigation. More specifically, KWR does not use the line lists, which are the documents that systematically organize the individual case information. So we don't use the line list outbreak reports and chart book that MDHHS had created, but we start from scratch from the Michigan Disease Surveillance System. And this is the digital Michigan database with records on all notifiable diseases in Michigan, of which Legionnaires' disease is one. And the rationale for taking this approach is that KWR has the assignment to conduct its own independent investigation. This also means that KWR has to verify all relevant data for all Legionnaires disease cases in the Michigan disease surveillance system for the research period of 2014-2015. To allude a little bit to the Michigan disease surveillance system, and this system has information in it. However, this information then needs to be verified. And so we do this through the medical records that were used for systematic case fighting, and to verify then the diagnosis of whether actually there was a case of Legionnaire's disease for each of the cases. The Michigan disease surveillance system is basically a system that serves as a signaling instrument for possible outbreaks. And then the way the process works is that MDHHS informs the local healthcare department to take further action and collect more detailed case information through questionnaires. And this usually comprises looking into the patient's home situation, their whereabouts during the period of onset, healthcare exposure, etc. What we have found as we have been going through all this data is that the available data collected in the questionnaires has a diversity in reliability, which is not unusual, I want to add. In the end, it is people that have to follow up the patients, or if the patient has deceased family member, may not have all the information readily available anymore. So that means that additional investigation has to take place to confirm, evaluate, and characterize the data in terms of the reliability for each case. And combined, this has taken more time than anticipated, and it also impacts the level of certainty with which conclusions can be drawn. So for this reason, the expected completion date, which originally we had set for the end of this year, has now been proposed to be extended by 2 months to February 28th of 2019. And at this date, the objective is that KWR will present a manuscript for submission to a high-quality, peer-reviewed scientific journal and a practical guidance document for improved Legionella control by outbreak-associated water systems. KWR has, after we submit the manuscript, we have no influence on the time of publication, because this then has to go through the review process of the scientific journal that we submit this to. But we expect that this will take place sometime around the summer of 2019. Then I want to talk a little bit about the healthcare outreach activity. This healthcare outreach activity is focused on developing an interagency strategy between the state agencies and the local health departments for Legionnaire's disease prevention. Legionnaire's disease prevention is a shared responsibility among many stakeholders, both within the state agencies, the local health departments, as well as the local health care facilities themselves that have to manage their water systems. And this is also what makes Legionnaire's control a challenge, because it's really a lot of different stakeholders that play a role in this. And with this effort, we try to address this, or the need in this area of coordination. Healthcare facilities have been identified as a priority because of their combination of complex water systems in which Legionella bacteria can grow, and the presence of vulnerable populations within these facilities. And when we talk about healthcare facilities, we are talking both about hospitals as well as long-term care facilities. In this activity, we first brought together the 3 state agencies with responsibilities for water management and public health. These were the Department of Health and Human Services, the Department of Licensing and Regulatory Affairs, and the Department of Environmental Quality. With these agencies, we established needs, gaps, and a strategy to improve interagency coordination. And following this, a second working session was organized with representatives from the local health departments. And this working session focused on coordination and capacity building needs concerning water management and Legionnaire's disease prevention at the local health department level. We are currently in the process of finishing our findings report and the review process by the state agencies and the local health department participants. And we aim to have the final report ready by the end of November. And that's the update, and I can take any questions if you may have any.
Questions? Dr. Sullivan.
I just have a few questions that, unfortunately, it was hard to hear some of your report. So I just want to make sure I understood some of the statements. As I heard it, you said that you worked with, through the Michigan Disease Surveillance Systems database, which identified case files. Is that correct?
That's correct.
What I think I heard was that you worked with survey information that had been gathered by the county health department for families or residences where cases had been identified?
Yes, so what we have worked with is so we went back to the source information. So following the identification of different cases, a questionnaire is being sent out or being taken off by phone in some instances with the patient or representative of the patient to collect information about the period of onset, so we can use that to trace back what the source of exposure might have been.
So are these surveys that were given in the past that you're reviewing, or are these new surveys?
These are surveys that it's retrospective, so right. We are using the existing surveys that were taken in the past, in 2014, 2015, by Genesee County and by the Department of Health and Human Services.
Okay, and then you made a statement about the conclusions that you could come to, at least at this point, or that you anticipated at this point, and there was I just couldn't hear. There was a word and then unreliable, or a word and then reliable. What was that? What was that character?
Okay, so the information in the questionnaire is sometimes incomplete and sometimes not entirely clear and reliable in terms of certain aspects of the information, and that requires additional research. So to give an example of this. In particular, whether a patient during the period of onset was on the Flint water system or not is sometimes unclear because the whereabouts in the timeline raise questions on whether that was on Flint water or not. So we have conducted a GIS analysis of all the different cases to actually establish whether the patient was on Flint water or not. So that is some of the additional research that we have carried out to really look at the geographic aspects in terms of where they were during the critical time. And other aspects we have looked at also are the medical records to see what were other health complications that it may have played a role to really establish whether there was a clear case of Legionnaire's disease or what other aspects may have played a role as well. And all of this is to characterize the different cases in terms of reliability on whether this was a case of Legionnaire's and in terms of the reliability on the source of exposure.
So will there be then surveys of those cases, new questions asked of those families or of those residences?
No. So this is all based on existing data.
Okay. And then I just have a question about your peer review process for publication. In my experience with contracts with the state, they required the opportunity to review documents and manuscripts before they were submitted to publication. Is that the case here?
Just want to make sure I understand the question. So is the question that before we submit the document for publication, if the state has to review this first?
Yes, that's my question.
Okay, I would direct that question to Mr. Hippica. Maybe you want to answer that as the contract manager.
Yeah, hi. So the short answer is no. This is an independent study, and it's as he already alluded to, how it's being conducted. So they will take their final results at the end of, I guess it's January to the IRB. February, they will publish, or they will finalize the report, and it will be submitted to an independent journal for eventual publication.
So with many of these journals, they embargo the results until publication. Will in this case, will that mean that these results won't be available until after they have been accepted and gone through the peer review process, and are ready, and publication is imminent? Is that about when we could expect to see these results?
Yes. Yes.
Yes, that is correct, and it is a very conscious choice we made. Because we do understand that means there's a longer time period from when we have the findings to when they can actually be made public. But we felt that was important for making sure that we really follow a good process so that the results will not be disputed. And that's a requirement in order to get this published, is that it will be under embargo. So that's part of the decision we factored in, but we felt it was important to make sure that we did this study to the highest standard, so that from a scientific perspective at least, the results meet those standards.
I can appreciate that. I think are right now undergoing this study just because peer-reviewed publications aren't being trusted. I have one other question. At the last presentation, we asked, I know that Dr. Pugh asked and Dr. Reynolds asked, if you could provide us with a list of the names of the individuals who are on your advisory panel. Is that possible?
Yes, that is possible, and I thought we had shared that, but if that's not the case, I will follow up on that. And I apologize if that didn't happen, but I thought we had agreed to share that.
It just hadn't dribbled down to us. So yeah, it would be great if we could have that. Thank you.
Dr. Pugh.
Yes.
Hi.
I will make sure that I will forward that to Mr. Hippica, and then from there I trust that it will come to the group.
Dr. Pugh.
So, okay, and I can understand and appreciate the embargo on the information, but I think that I heard you say that anything that's coming out of the data that you're seeing, if it's anything that needs to be shared, you're sharing that with our local health department. Can I understand that to be correct?
So there are two aspects. So as part of the analysis, there are also certain findings in terms of how you may want to follow up in the future should there be a Legionnaires outbreak, in terms of how you handle that. So we will not be able to share any of the conclusions publicly until we actually publish it. However, the recommendations in terms of process, which is the other document that so the recommendations on that, those we can share earlier.
So I just so we're clear, I know ethically, if there's anything that you're seeing in the data that the health department needs to know about, that our water system needs to know about, our hospitals need to know about, as we're making sure that our residents remain healthy, that you would be able to share that information. And that's just what I want to be clear of.
Yeah, so what I can say is we can share recommendations in terms of aspects that require attention. We cannot share the conclusions of the study in relation to the 2014-2015 outbreak until we actually are officially published, which we expect in the summer of 2019.
There's no recent data in the study in what he is reviewing. So I want to make sure as we sit around the table today that there's nothing emergent that will come out of that. It is a analysis of data from the past. And so because of that, we're examining at this group's request to do a deeper dive into the science, and that's why KBR is reaching to their independent review board to make sure that the data that comes out has been peer reviewed. But there will be nothing emergent that will come out that could speak to your concerns around addressing any potential concerns that may be relevant today.
And I'm just speaking of like procedures, protocols, the way that we conduct business
Sure.
here, that they might know and that we need to know in real time.
And so that element is the first part that there's 5 parts of this overall contract with KWR. And so parts 1 through 3 is the engagement with the community and the county health departments. And so there's been a series of meetings, as was alluded to by KWR, that have engaged local health departments, and the city of Detroit has been present. It includes both urban and rural folks from all over the state who are providing feedback to HHS, to the DEQ, to LARA. It's a multi statewide as well as local and county representatives who are providing the feedback in a draft document that they just actually pushed out to that audience. I believe it was actually this week, if I'm not mistaken. Is that right, Ruud?
That's correct.
Yep.
Was this week.
Yeah, and that is examining best practices and where the touch points should be in order to really examine how we can not have the same and it's about preventing something like this in the future. And so it's about the statewide model, and again, all tied back to the Flint Water Advisory Task Force report as one more recommendation that was in that report of the 44.
Just one more question. So is there a reason why the mayor's chief public health advisor or the city of Flint's chief public health advisor has not, you said many meetings, so I'm just wondering why I haven't been involved. Is there a reason?
And as far as the group that is on that committee, I was not involved in how those folks were appointed. I'm not entirely sure how those folks were selected. I think it might have just been a who wants to be involved. Hey, Rudy, can you talk to that? Yeah, please.
So we, because we were looking at this as a statewide effort. We worked through Melv and Malia as the statewide organizations, and we approached them to ask their membership to identify volunteers to participate in this.
So you use two. So MALF is. Are you familiar with MALF? Okay, good. So it's the Association of Local Public Health. And so, thank you, Larry. And so, so they were the ones that helped us choose, I guess, the overall composition of the group.
Is there, just a side question to follow up, is there a way to include Dr. Pugh at this point? This is Mr. Schooler.
Sorry, I was not able to hear that question.
Is there a way to include Dr. Pugh from the city of Flint at this point? In terms of,
is there a way to improve?
Include.
Yeah, how about if we just get her a copy of the report? I can forward it to you, Pam, from a draft perspective.
Yes, if you send me the contact information, I'll gladly share it. That's no problem.
I'll take care of it, Ruud. I'll just forward it over to, thanks.
Dr. Reynolds.
Yes. Is the contract between the state and KWR available to the public?
Yes, as all state contracts are. So it is housed in my office, which is why when I introduce myself, it's my Office of Performance, and I'm underneath DTMB. And within that framework, I report to the state budget office, but I'm assigned to DTMB from a contractual basis. So, and I now sign the contract.
Can that contract be made available to FWICC members upon request?
It is available to any state resident, so short answer, yes.
Yes, so I'm requesting a copy, number one, because I've never seen it, just for my knowledge, so it'll help me explain things in the medical society and in the community. My next question is, there was a preliminary report that constituted a critique of the work that was in the previous study done by FWICC. And if I remember correctly, they addressed certain methodological shortcomings, disagreements, or differences in perspective. Is there any document that reflects how KWR will specifically address those issues and concerns that they identified? And will that be available also?
If I'm hearing your question correctly, I believe that document was published last year, and that document is also available, and it's been published online for quite some time. So insofar as what this element is trying to do, it is designed to address some of those concerns and try to dive into greater depth and detail associated with the data points that they had identified as potential points of concern in their initial report. Dr. Reynolds?
Rich has the clarification to that point.
Dr. Reynolds, I want to remind all of us that, so the original scope with FWICC was, can you create research methodology that helps us understand causation between the switch to the Flint River and the spike in Legionella? For a whole variety of reasons that we've discussed in the past, Health and Human Services was ill-positioned to be the contract holder. And so it became clear to us, and you even mentioned, or Dr. Pugh mentioned, the desire for folks to, be able to review and advise before publishing and those kinds of things, that it was really difficult for me to be able to defend that this is truly independent when these restrictions are there. So I actually made the recommendation to the governor, who suggested KWR as the truly independent, no state affiliations of any way, shape, or form, and so KWR wanted initially to go down this path with FWICC. For a variety of reasons, it was determined that FWICC didn't want to go that route, and so we made the determination that they should continue, because we're still asking the same question, and would really like to have some answers. And so I can tell you that nobody at HHS, nobody at DEQ, frankly, even Scott himself, this is truly independent what these folks are doing. We don't have any touch points other than the agreement of the contract, and you're more than welcome to the contract as well as any deliverables that have been created to this point, because I think you want the same answers that we do.
And to that point, I can assure you, those of you who were never in those deliberations or meetings, that FWICC was extremely careful in holding their data clean and did not change anything based on what we might want to see, or they did their work independently to the degree that HHS allowed them to do so. But it goes back to my second question of the first part, which is there were methodological concerns that were expressed in a preliminary report. And my question is, does the contract address those methodological concerns, specifically the ones that were addressed, and how things would be done differently? That's the question I'm asking for an answer to.
Hey, Rud, can you speak to, and I know you're not on the science side of this, but so I don't want to get too complex today, but can you speak to that question at all by Dr. Larry Reynolds?
I will try. So what we did, and that's the publication that was released, I believe, February, March of this year, which was the report we did on the initial evaluation of the FWICC products that had been released. In that report, you will read, we did express a number of methodological concerns, and after the conclusion was that the original intent, which would be a partnership in which KWR as an independent organization, scientific organization, would provide independent scientific oversight to bring this project to a conclusion. When it was decided that that was not an option, then the decision was made to focus in particular on the retrospective analysis of the 2014-2015 outbreaks. And that's really where the emphasis of our effort has been, in combination with the other component that I discussed, which was the healthcare outreach component.
Would it be fair to point out that the previous study was also embargoed pending peer review and went through the same publication processes that you will be going through soon also?
That is a correct statement.
Thank you.
Okay, we will have to move this agenda. So Scott, you have the floor on the 75-point plan.
I'll be very quick. In front of everybody, there is your handout, which is an updated copy of the governor's 75-point plan, and I refer to it as that because in terms of our partnership with the city, with the county, with this, and with all of the community folks that are tied to this, it was referred to that in the media. That's how it was framed by the media. And so I chose that. They framed it as the governor's 75-point plan. But truly, this has been a collaborative partnership between all of us around the table here, the city and the county. We are, of the 75, we are 73 actions completed with 2 remaining. We believe we will get those 2 before the end of the year. The remaining 2 are associated with launch 25 new businesses by the end of this year, and we're very close to that here in Flint in partnership with the chamber as well, and then the other one has to do with the grocery stores here in Flint as well. So I won't, for the sake of time, Harvey, I won't go into a little depth. I'm certainly open to take questions either now or after the meeting today to get into more specificity about the actual complete ongoings. But I just did address the 2 items that are still remaining and in progress.
Any questions for Scott? Dr. Sullivan, sorry about that.
Is the concern about the cost of water and water rates that resulted in the creation of the Water Rate Subcommittee, is that one of these points? I can't find it.
I don't believe it is. I don't want to speak ahead of you, Scott.
Yeah, so if you flip to in your handout, which would be page 123, you'll note the specific elements that are associated with water supply and infrastructure. This speaks to the overall short, mid, and long-term goals associated with water.
Right.
Water rates was not an element that was specifically identified in the 75-point plan. It is on my area that I track outside of the 75 points, which are 350 other items that I track every month. And I know those conversations have been ongoing with the city. I know the city's CFO is here as well. And I know this is near and dear to the mayor's agenda and heart.
Dr. Reynolds, was the water rate concern part of the original report?
I can't recall if it was one of the exact 44 recommendations, but FWICC did organize a water rate subcommittee. There were 6 recommendations submitted, and if you wish, I have a copy that I can give you to see if it went up the chain to you. However, and they do require significant changes in state policy, and I'm sure Mike will remind me that there's regulations and there's laws, and I respect that, but there were 6 recommendations made, and if you'd like a copy, I can walk it around to you.
Well, let me just clear that up. So all the FWICC members, including Scott, received a copy of those 6 recommendations, so it's not necessary to do that. When this body makes a recommendation, it goes directly to the governor. So this is an advisory committee to the governor. So it's not an actionable thing. So those recommendations did go to the governor. Now, a lot of those recommendations had to do with some heavy lift on some legislation, and without getting too detailed in between what was happening leading up to the primaries and all this stuff, it was very difficult to start some of those conversations. It'd be something that I would, hope that members from this community would encourage the next administration to look at. I believe those recommendations were very good. You had experts from Michigan State involved in it. They know what they're doing on this, and I think it's worth looking at. So, and the city of Detroit had begun some of their lobbying efforts within Lansing as well to address some of their shutoff issues and rate strategies for the city. And it really just got bogged down in a number of other legislative issues. That's the reason why it hasn't really gone anywhere. Those 6 recommendations are not light recommendations at all. But they're very, very good recommendations. One of the things that Mike and I talked about is, whether or not we can have the MPSC have a regulatory function on water. It's a lift. It's a big lift for that to happen, and I just don't think we have the time to do that kind of lift for that reorg. And am I pretty much correct on that, Mike? Okay, so it's there. It did go up the food chain, and that's where it is right now.
And Harvey, once again, I have to say, we have to decide how low will we aim, and as the Great Lakes state, how high will we aim to address some of these issues regarding water that will have long-term implications. Thank you.
Well, point well taken. Dr. Sullivan.
I think that this 75-point plan report is a self-assessment, right, of how much of what we said we were going to accomplish, we accomplished. I think that the recommendations of a subcommittee that have been sent up the chain and just sat there, that's another form of our assessment of how effective we've been. I'm wondering if other subcommittees of this body have had recommendations that went up the chain that were also left unattended to.
I can answer that too. The answer to that question is no. The rate subcommittee was created after we began the FWICC down the process. When we created the original subcommittees, those subcommittees were distinctly tied to the action plans, the 44 action plans. In fact, it was based on the recommendations that came out of the Flint Water Action Task Force that Dr. Reynolds actually sat on. Each one of those subcommittees that made recommendations made them against those recommendations from that task force. Those were actionable. Those are in this document. The rate piece was something that everyone had talked about. It keeps coming up, and this group felt that it was well worth the time to actually have a rate subcommittee. We had that rate subcommittee. They made recommendations. The body, the full FWICC committee, voted on that as a recommendation to the governor, and that's where it went. So there haven't been any other balls that have been dropped. This was a new kit on the block in the sense of the subcommittee actions that the FWICC has taken up. Any additional things that anyone wants to say?
Just slight clarification. Okay. Dr. Reynolds and I have had this conversation a couple times. Essentially, what is being proposed would be rate regulation of water, much like other utilities. That can't be done by reorganization. It cannot be done by executive fiat. That is, I'm not being judgmental at all on the idea. I think the idea has its attractions. This is a large legislative package. The success of that large legislative package, with all of the interest you're going to receive from the public water systems around the state, the municipalities around the state, and the citizen groups around the state, should the next administration consider this, is going to require quite a bit of coalition building. It's not like you're going to drop a bill in and get success. And by coalition building, I don't mean you have to go down to the lowest common denominator, but you have to do the outreach to see where the pain points are, so that when it ultimately is implemented, is passed legislatively, you can implement it. So there were many, many recommendations in the 75-point plan, some hard, some low-hanging fruit. I'm not saying this is the hardest, but this is a long-term, significant shift that could have arisen out of some of the issues in Flint, but this is a long-standing issue. It should be addressed.
I agree, because I sat on the rate committee.
Yeah.
So, it's something I think is should be beneficial for this state. Dr. Atisha.
So a few other recommendations that kind of came out of this work, really more from the task force report, was the creation of the Environmental Justice Commission, the Michigan Lead Elimination Commission, and the Public Health Commission. And each of those commissions has a whole kind of suite of recommendations. Some have been acted on and some haven't, but really that is kind of was conceived out of this work too, and there's a lot of work that needs to continue.
Yeah. Thanks, Dr. Atisha.
So of the 44, just to put a fine point on that, we're 28 that are either complete or complete ongoing, and we are 16 that are still working, because some of these are, as has been alluded to, very long-term actions that require some significant activities to achieve the desired outcome. But I just wanted to put a point on in terms of where we are with that, because those are the two, I tend to report on those two outcomes a lot in these meetings, both the advisory task force report and the 75-point plan.
Dr. Sullivan, okay, go ahead.
Just one, I understood it, but just this document may travel someplace else. I just want to make sure these were things that we said at the very beginning when we just started, were goals or plans or so forth. One of them could draw some attention if people didn't know that context, and it's in the water supply and infrastructure section under intermediate goals, where it says that we have partnered with city and county to plan for a future connection to the KWA. Okay, at the time that was a goal, and we know that we're no longer considering that, which is why there's a check mark. But this document without that context, and I don't know how that would be changed. It's probably important that it's not seen as that is something that's happened.
It's also in the long-term goal, smooth transition to KWA.
Right. So we were very obvious as we did not want to change too much of the actual language. So we wanted to get this out today to each of you, but we can certainly, once we finalize this at the end of this year, we will make sure that the language in here is very clear with the addendums that were made to reflect those changes. Because as we've learned more, we've been able to modify things, and that's how we've been able to be, really flexible to meet the needs of the city and the county.
Okay.
And the status of those 44 recommendations will also be in print, also a document?
Sure. We can get that out to this group as well.
Okay. All right, so we're coming down to member concerns. There were two items on here. I'm not sure if the first one is going to happen. The intent of that first item was that there were some concerns expressed by some people, I'm not going to mention, that because this administration is ending, that we would encourage the work to continue. And so with that...
Yeah, Harvey, let me take ownership.
Go ahead, thank you.
This was more a reminder for those of you who didn't know that by the operation of the executive order that created this body, it expires on its own by operational law on December 31st. This is just a reminder. We've all talked about this being the last meeting, but the last meeting is because it's not legally constituted as of January 1st. So...
And if I can just weigh in, we've been having ongoing meetings with the governor-elect's transition leadership, and we have made a recommendation that the work of this body continues to be relevant. It needs some reconfiguration with regard to its membership, but we have recommended that the governor-elect consider keeping this body intact, or not intact, but making whatever adjustments she feels appropriate. But the work continues to be very important work, including those recommendations that need to still stay on some kind of a profile, a high-profile track. So that's, Dr. Mona and I had made we had a discussion about maybe asking this group to take a resolution. We backed away from that for two reasons. One is a number of the folks that would be voting, don't have status post December 31st. And secondly, no governor really wants to have their hands tied in some sort of a way. So even though we were well-intentioned, we kind of decided that was probably not the right way to go, which is why we're not advocating a resolution, but we are on record with the transition team saying this is really important work, and we think the mayor and her public health people significantly rely on the folks around the table, and that we should continue to have that linkage with the incoming administration.
That Mona is on the transition, so I would suggest if you guys have any ideas on how, whether it should be recreated or reconstituted, how its goals should be set, you might want to talk to Dr. Mona Anastasia.
Okay, that's that. So this is the last meeting, so just open it up for any comments at this point from members, and you're going to start?
Yeah, but I'm not commenting. I'm not following your rules, Harvey. I mean, this is very quick. There were a number of concerns on hepatitis A. I gave a sheet to Dr. Reynolds, but I'm sort of feeling guilty about that. Not that giving it, I can remember, Larry. Dr. Wells has provided me via text just some data, and please, I'm looking at, not you, Mike, you three, try not to drill down on the data. I'm not an epidemiologist, nor am I a public health official. I'm playing the role of the statistician right now. So in terms of Hep A, if you go back to 2014, 2015, the numbers for statewide for that year were around 40. 40 one year, 53 the next year, 0 in Genesee, 0 in Flint. The peak was in 16-17, where there were 906 statewide, 27 in Genesee County, 14 in Flint. 2018, the most recent year, we're not there yet. It's 215 statewide, 17 in Flint, Genesee County, 8 in Flint. It's continuing to trend downward. Nobody's claiming success, but if you look at the sort of monthly totals in Genesee, they continue to drop. It went January 0, February 2, March 2, April 4, May 3, June 4, July 1, August 1, nothing since August. In Genesee County, not statewide. While the numbers are going down, they're not back to baseline. Nobody's screaming we're at a success point. I do not expect to fully realize where we need to be for another 9 months. Remember, we are essentially dealing with a very, oftentimes a hard to reach population. Vaccination is the remediation. So Department of Health and Human Services, working with the local public health offices, is really pushing that remediation effort through vaccination. We're going to continue to do that. I guess just the numbers are trending down, but we're not there yet. How's that, Larry?
Are these just calendar years when you?
Yeah, these are calendar, not fiscals.
Dr. Reynolds, and thank you for your comment for the last meeting.
And I want to start off by saying I always appreciate the work that state employees do. Those who truly have the concern for the health and welfare of Michigan residents, and I count most of you around the table as part of that. However, if you'll just consider my analogy, would you smoke a cigarette while you're pumping gas? I'm pretty sure you tell me no.
You're probably asking the wrong person, Larry. I'm the only person in this room that smokes.
Okay. Well, if you have people who care about you, I'm sure they say, please, Mike, don't do that. And what I'm insisting is if we cut off people's water during a hepatitis A outbreak, we are doing the equivalent of that imprudent practice that does not support public health. And if we're truly going to talk about health in all policies, it's something that we have to address. And it may even get to the point where we have to place the public health over physical needs. Once again, thank you.
Any other comments? Remember, Jim.
Yes, I pretty much think this is my last meeting, being representing Genesee County from Saginaw County. I was asked to sit in and see if I could add my expertise in the field of water services and systems and that sort of thing that I've worked on most of my life. But I can say that I've enjoyed it. I've learned a lot, more than I offered, I'm sure, and I am proud to be considered somebody who worked on this. I'm still working on something, but I can't tell you what yet. But someday I hope it'll come.
Thanks, Jim. Thanks, Jim. Councilman?
Yeah, I want to thank everybody for participating in these meetings. I think that they have been very useful. I've included members from the city, from the state, from the even federal government I've seen at times. So I think it's really important that hopefully we do continue these meetings with the next administration. And hopefully I see many faces back up here voicing their concerns, asking really good questions, and the state responding with some really good numbers and accurate information. So thank everybody.
Mayor?
I just wanted to say a few things. First, as we're closing, I want to say that I'm really proud of the rate with which we have been able to replace the lead and galvanized service lines. I think we've done a tremendous job with that. While I'm not happy about what has happened here, I am happy that we have raised awareness not just across the state of Michigan but across the country when it comes to looking at water quality standards and the importance of maintaining and investing in infrastructure. And I know that people have paid attention to that and that they've learned from us. And I'm grateful about that, because one thing we do know is we don't want what happened in Flint to ever happen anyplace else in this country. We don't want that to happen. I want to just close with something that I opened up with. And while we are going to continue to move as quickly as we can with replacing those lead and galvanized service lines, I want us to be completed with that. And I want our medical community, I want to have their blessing before I sign off and tell people to start drinking the water again. And I will not waver from that. Something else I will not waver from is cutting cost on how we do our lead service line replacement. I will not waver on that, because 95% is not good enough for us. If we're going to get the lead out of Flint, we're going to get it out. And we have stayed within our budget. And I don't like insinuations saying that we have not done that, because we have. And every single life in the city of Flint is important. And so if we miss one person, that is one person too many. So that is not going to change, and that will be the message as we go into this next administration. And while I know it's been a rocky road, it's never been personal against anybody. What's been personal is our commitment and our passion for the people of the city of Flint, and making sure their health and well-being is above everything else. That's going to be above everything else. And Dr. Reynolds, as you talked about health and all policy, that remains our focus, and we're not going to change from that. And health and well-being comes over finances. It will always come over finances, at least while I'm here. But I do want to thank everybody. Because it hasn't been easy, and we've fought, and we've come back together, and we've been able to make some things happen, some great things happen for the people of the city of Flint. And so I just want to thank everybody for their time, their effort, their energy, and their commitment to helping us move things forward. So thank you.
Rich?
Mayor Weaver opened and closed with a thank you, and I'd like to close with a similar sentiment on behalf of Governor Snyder. When Dr. Mona and Dr. Edwards presented their findings, and the severity of the water problems in Flint really came home to roost with us, and many say we were slow to react, and we were. We weren't scientists, and we were getting what I would call rationalized answers, and we didn't know enough to dig deeper and ask more questions. That came much later. But at any rate, the first thing we did was work with the mayor and the Mott Foundation to switch the water source back to Detroit. The next thing we did is we stood up the Flint Water After Action Task Force, led by former Senate Majority Leader Ken Sikkema, and these were bipartisan but truly independent thinkers. I've gotten to know Dr. Reynolds. I admire him as a outspoken, passionate advocate for children and all people, and I would never take any anything that he has said as anything other than let's shoot for the stars, and we appreciate that. Politics doesn't always allow us to get everything done that we would like to get done, but I can honestly tell you we've given it our very best shot, Larry. And then, of course, by executive order, we stood up the Flint Water Interagency Coordination Committee, and this group has been incredibly effective at the local and county and state level, and I count all of you, including Mayor Weaver, as not only a team, but friends and colleagues. And the mayor's right. It has been a rocky road at times, and, nobody ever agrees on everything, but the one thing that we always agreed on was that we were going to do our level best to try to make up for the bad things that happened here on our watch. And responsible leadership means, I've had this conversation with all of you. Governor Snyder didn't cause this problem, but it happened on his watch. And the mark of a leader is you step up and you say, we've got to do everything humanly possible to try to mitigate the risk and enhance the quality of life. And whether that's been the nutrition programs that we've put in place, the case management for elevated blood lead levels, the education for early on and great start, the economic development to try to bring jobs and opportunity here. The Mission Flint team is the first team that actually had 18 separate cabinet and administrative agencies all working together on behalf of the people of Flint. And frankly, it serves as a template in my view for how you come together and try to deal with the problems and try to exploit opportunities wherever you can. I used to open up every one of those weekly meetings we would have, Cheryl would bring in somewhere between 5 and 7 community residents, and they would start off the first half hour telling us what it was like to feel betrayed by your governments, and what it was like to be afraid of the water coming out of your tap, and what it was like, to feel that you're a bad mother or a bad parent because you may have unwittingly let your children ingest things that are harmful to them. Those were really, really hard things to hear, but we needed to hear them, and we heard them every single meeting because it strengthened our resolve that no matter how heavy the lift, we were going to take it on. And so, I would give my eye teeth to prevent what happened here, but I also want to tell all of you on behalf of the governor that despite the fact we wish this chapter in Flint's history had never happened, the opportunity to work with all of you and to do things for thousands of people that perhaps we'll never meet, but hopefully we made things a little bit better, and it's all about quality of life. So even though, Mayor, we didn't always agree on everything or try to get the way forward, sometimes you and I and the governor agreed and we couldn't get our other government partners to go along. But we worked together in a spirit of cooperation and teamwork. I have nothing but the highest regard and mutual respect for the mayor and her team, and we've all tried to conduct ourselves in the Snyder administration with a sense of personal responsibility. And I just wanted the opportunity to say on behalf of Governor Snyder, we thank you for your service, but more importantly, we thank you for the privilege of allowing us to serve with you. So thank you.
Well, given that, and not unless my other co-chair wants to say anything, would you?
I'm all set.
He's the new emergency manager. If you didn't know that, replaced Captain Kalinsky, who's now Lieutenant Colonel Kalinsky, a big dog. Yeah. I'll just close by saying everyone has said a lot of what I wanted to say. I mean, and certainly the mayor kicked it off. I remember meeting the mayor right after her election in November in the governor's office, and she came in with a team of folks. And ever since that time, she's been very diligent, very bold in her actions, and her calling the emergency, rightly so, really kicked things into a different level, certainly after Dr. Tisha's report. And that's the cadence that she's maintained here. And you and I had conversations before. You can wrap a 2x4 around somebody's head pretty good.
Pretty good.
Yeah, pretty good. But you know, it's all for the benefit of the people here, because it's not about anyone at this table, but it's about those residents out there who were scared, concerned. They didn't have all the information. They weren't scientists. They weren't, fancy smanchy this or that. They were just people who wanted their water, and they wanted to live in a community that had a good quality of life. And so everyone around this table, I watched, participate in a lot of the things, and everyone has been very diligent. Rich Barrett has taken this to heart, even moved to the city of Flint, has worked tirelessly on behalf of the governor, and there's a lot more that needs to be done. But I think everyone should feel good about being a part of a group that has done a lot. One of my goals, and I stated this to the group before we even got started, that the desire is to leave Flint better than where we found it in 2011. This is way before the crisis. So, not to put a Band-Aid over the issue, not to try to find a quick fix solution and get out, but to fix this issue and to leave the city better. So I think it's on a good trajectory. It's been a pleasure herding cats in this room to get these meetings going. I thank you for your participation. I thank Deanna for stepping up and filling in Stacy's shoes, and because she was a stickler getting these meetings done. And I wish that each and every one of you have a blessed holiday season. And so with that, the meeting's adjourned.
Thank you, Head Cap.
Thank you.
All right.